let's go to have a look at the future now. So, Professor Pig again, are there any important technological advances or developments in research regarding the monitoring of iron overload that our audience, the health professionals, should be aware of?
Well, there are many interesting things on that, but let's say for research, for the clinical setting, there is nothing so exciting to be said, because in example, to have a quantification, a precise quantification of iron load in other organs, like the pancreas, the hypophysis, and other organs, that ideally is in and may be important, is not a problem of new techniques, is a problem of physical limitations. So there is nothing, you can read many papers on the evaluation in other organs, but if you go to the daily routine, nothing is so important to be underlined here in this session. What is important is to have in mind what we are discussing in front of a new therapeutic approach, because these approaches that I'm mentioning, gene therapy by gene editing at most, it's a reality now and is progressing in several countries in the world, starting to be applied, and we hope in the future to have the chance to apply in low resources environments. And so having these in the next years in front of us, the iron load diagnosis, monitoring and treatment is by far more and more important, because it's nothing to try to cure a thalassemia with a gene therapy if the level of iron toxicity has been so high, then the level of iron overload is so high that the perspective of life of the patient are very poor.
Okay, so the methods we have now, they are accurate and reliable enough as long as there is access to these methods and also proper external validation, right?
Yes, exactly. We don't need, because we need affordability and calibration of the methods in each system.
So coming to the end of this podcast, I will now pass the floor to each one of our guests for some closing thoughts or remarks. So I will start with Professor Porter.
So the immediate challenge is to roll out affordable measurements of iron across the globe that can be repeated on a regular basis. And we've spoken a little bit about that. The technology exists, but we need, and one is an important role of TIF to work with the individual countries to work out what the roadblocks are to implementing frequent monitoring. Changing slightly, a vision for the future, I would like to imagine a situation where when the liver is to be monitored, we get a one hit. We not only get the iron, we get a measure of the fibrosis, of the fat content, and other aspects of liver health. And that ultimately would be nice to do as part of a package in all thalassemia patients when they come for their yearly monitoring.
So I think that monitoring additional things will be very important in the future as our thalassemic population gets older and older now with the advances in therapy. So we will have to face different challenges in the near future, like the fatty liver disease, as you said, and other conditions. What about you, Professor Piga? Any thoughts, closing thoughts or remarks?
Oh, but to close this topic, I would like to focus on the policymakers and in general any healthcare system that is for these diseases, that is thalassemia syndromes. The most important point is to have the MRI assessment. We talk about iron assessment today, but as you mentioned, for other aspects, MRI is important. To have an MRI assessment included in the standard and possibly covered by the public health system for these diseases. This, to me, is the most important point. And fighting for it, any role each of us has.
And of course, TIF has made a lot of efforts towards this. First of all, to assess what are the roadblocks or the challenges in the different countries, which actually differ from significantly from country to country, and also to support the healthcare professionals and to talk to advocate for this to policymakers, governments, and so on. So thank you, Professor Porter. Thank you, Professor Piga, for this, I think, interesting discussion. And thank you all for attending this podcast. And please stay tuned for the next TIF podcast on another important topic.